Healthcare people, therapists and doctors and nurses and the folks, orderlies and other folks taking care of things. One of those family docs who's helping hold up healthcare in this city and around is Stephen Albrecht, a family doc. I want to ask him to come up here and give us the doctor's prescription about what needs to happen in healthcare.
Thank you. Thanks for coming out. Glad the sun's coming out and warming us up. We don't want any hypothermia out here. But my name is Steve Albrecht. I'm a family doctor. I've practiced here in Olympia for 23 years, and it's been a real privilege to serve the community. But I'm here today to give you a doctor's checkup on what's going on. All right, I'll get really close. Thanks. So I'm here today to give you a doctor's checkup about what's really going on with our healthcare non-system, because it ain't a system. Don't kid yourself. Okay? I'm going to give you a hopeful prognosis, because we do have a chance for some things to get better. And in the end, there's a prescription, so you got to take your medicine, all right? So first, the diagnosis, okay? We do not have a system of healthcare in this country. We have a hodgepodge. People get care when they can, and people don't get a lot of care that they need. So anybody that tells you we've got a healthcare system is speaking with misinformation. Think about what you've heard this morning already. Think about what's happened to your family, to your friends, to people you know, about how they've struggled to get care that they need and been unsuccessful or had to fight upstream like a salmon. That's not a system of healthcare that's rational and reasonable. If we knew somebody who made this kind of system, we'd condemn them for their negligence, because it doesn't work for us. We ration healthcare in this country every day, day in, day out, and we do it based on economics, and we suffer for it. So anybody that tells you that this reform represents rationing, you tell them it's the right kind of rationing, because the rationing we're doing now is killing us. Our communities suffer with the illness. Our businesses suffer from economic disadvantages. It drives families into bankruptcy, and we're not healthier for it. Greed on the part of drug companies and stinginess on the part of insurance companies make us all suffer and make a very few extraordinarily wealthy, and it's not right. In this country, our society believes and endorses that healthcare is a right that we should all get, and we should all get it at the right place, and we should get the right care, and it should cost us the right amount. We're sicker because of the way we deliver health care in this country. We pay 1.5 times more than any other industrialized country for the care we deliver. And when we measure our health care outcomes against other industrialized countries, we come in at the bottom or last of surveys. We're right ahead of Slovenia, but Portugal and Poland don't have to worry, because we're behind them. And that's not right either. We spend hundreds of millions every year getting the wrong care, because our incentives are the wrong incentives. It's do more and earn more in healthcare, and that's not making us healthy. We're giving people the wrong care, and we're doing it for the wrong cost, and this healthcare reform can change that, and we have to make sure that it does. Our system has been misaligned, and it drives people to do the wrong things. We've stopped getting primary care doctors like family doctors and pediatricians and internists out of our medical school, and medical students now learn that the road to financial success means radiology, ophthalmology, anesthesia, dermatology, and that's not how we should be delivering our health care. But there's good news, and now it's coming, because there is a cure, and that cure is for our senators in Washington, D.C. to pass meaningful and substantial health care reform. And we want it. Yeah. their bill is the Patient Protection and Affordable Care Act. And it's to a great extent supported by the American Academy of Family Physicians and other doctors and organizations that take care of people, not sickness. So we want a people-oriented, wellness-oriented healthcare system out of this reform, and we're not going to waste this crisis. This legislation is a first step, as we've heard, and it won't get us all the way there, so we can't give up after this year. But we're long overdue for this, and we've got to tell Santa Murray and Santa Cantwell and Santa Reed that it's time for this, and we want them to wrap it up by Christmas. We've gotten too many lumps of coal in the past, and we don't deserve them. Okay? This bill will start to rectify these extreme misalignments in payment. And it'll make the imbalances that drive people away from family medicine and primary care, it'll fix that. We'll start paying for the right care at the right place, and we'll get the right cost. We'll stop gouging seniors by closing the donut hole that's none too sweet. Okay? We'll take away those hidden kickbacks that drug manufacturers and device manufacturers give to people who use their products to nobody's benefit except their own. Now, personally, I can't say that this bill is perfect, okay? No treatment was ever without side effects or risks, okay? So we got to stay on top of these folks. Personally, I think that we need to point out to our senators that there's a few possible problems. We've already heard about one problem. Louder! We don't want healthcare reform to take away a woman's right to choose and a woman's right to reproductive healthcare community. Bill Clinton said it when he said that abortion should be safe and legal and rare, and we don't want Stupak and others to make that unattainable. We also don't want our healthcare system to become part of our immigration policy. And our community is only as healthy as its weakest individuals. So we shouldn't let untreated illness threaten us all because some people believe that it should be an immigration issue. We've got to treat everybody, we've got to give access to everybody who lives in our community. So, in summary, when you call Senator Cantwell or Senator Murray, or you write them, and yes, that's the doctor's prescription. Cards over here, phones on your belt. You need to call Senator Murray and Senator Cantwell, and you need to tell them that you know that healthcare reform is good for our economy, it's good for our citizens, it's good for our community. You tell them it's supported by the doctors in this country who are experts in prevention and wellness and who take care of us as people. And you tell them that it's overdue and we're ready for it, and again, to wrap it up before Christmas.